Good evening, everybody. Hope you had a good day. I'm just checking in on ya. Got my sidekick over here. Fred's in the floor. Today, I wanted to talk about mental health and talk about a little bit of my struggles and my family history on that. I've mentioned in a couple of my videos that I've gone to therapy before, and at one point I was, for 6 weeks I was going 3 times a week when I was going through a tough time. And I went to my doctor, just my general doctor, and I was just beating myself up, like I'm weak. You know, I don't know why I can't get it together. I was just really beat myself up about it. And he told me that he said you wouldn't apologize if you had or feel bad if you had diabetes or something. I mean, there's nothing you can do to control that. If you're prone to that, you wouldn't be beating yourself up about having that. So why are you doing it when you're needing some help with your mental health? And I never thought about it like that, but I think it was the time that I grew up in. I know, my parents during their time, I mean, it was really frowned upon. I mean, it was just a big stigma. If someone needed mental health or going to a psychologist or a shrink or whatever you want to call it. So I know at one time my mother was going through some difficult times, and I brought up, maybe she needed to go and talk to someone about it. And she got very angry with me, saying I'm not crazy, and so there's that stigma there. I think a lot of some of my family members probably self-medicated because of depression or anxiety or whatever. They self-medicated with alcohol because there's some alcoholism that runs in my family. So I don't know it 100%, but I'm pretty sure that they were just probably trying to self-medicate because they were, stressed or depressed or something. The reason I'm bringing this up today is I just want to kind of take the stigma away from, if you need help, to reach out to someone, a professional, or just anybody, please get some help. And I want to take away that stigma of, someone needs help mentally. It shouldn't be frowned upon. If someone needs help, they need help. And it's very misunderstood because there's not a test. You can't like take an x-ray, of your brain and just say, oh yeah, you've got depression or you're suffering from this. If you have a broken arm, it's easy to look at an x-ray and say, yes, this is, you got a broken arm, let's do this. But mental health is really, it's a difficult thing to, I guess, to diagnose, and for people are, kind of have a negative view of it if they need help from that. And sometimes people suffer in silence. I have to be careful to, make sure that I keep myself busy because I suffer from depression and anxiety, so I have to really keep a check on it. But I just, like I said, I just want to bring attention to it and try to take the stigma away from, if you need help, you need help. So, reach out if you're having trouble and struggling. Just reach out to a resource and get yourself better. I hope you have a good rest of your evening. You take care of yourselves, and I'll check back in a day or two.